Welcome back, everyone. We're on Health Watch at 8:23 this morning, and researchers already knew that a certain flu vaccine reduces the risk of the most common form of childhood cancer. But now a new study reveals why. And here to explain is Dr. Dat Tran, a pediatric allergist and also an immunologist with the UT Health Medical School. Good morning to you, Doctor. Thanks for being here. So we'll start with the vaccine. What exactly is it? What is the name?
So the vaccine that's been going on, we've been given is Hib vaccine, so it's for the bacteria Haemophilus influenza, which is the second most common bacteria that causes ear, nose, and throat. The most common being Streptococcus pneumoniae.
Okay. And when typically do children, are they able to get this vaccine?
Yes.
When is recommended?
Right, so this vaccine is included with multiple other vaccines during infancy, so during the first year of life, and then later on during the toddler year.
So I mentioned that this vaccine reduces the risk of the most common form of childhood cancer. Why, though? Right.
So this is not new because they have other infections and other causes can also cause cancer. You know, so we have the human papilloma virus that causes cervical cancer. Unfortunately, now recently we got the vaccine for it. So how it works in this vaccine is it's only for genetically susceptible people. So that's really important to know. So cancer occurs in people who were born with one mutation in a gene that causes cell to lose their regulation of growth. Okay. And then so you're born with one defect, but that doesn't give you cancer until you get the second hit. So sometimes infection causes your immune system, because this is a cancer of the immune system. All right, so it causes the immune system to go out of control, and the specific immune cell is a B cell. So the B cells in certain infection start to go out of control, and then it causes them to get a second hit to that mutation, and that cell starts to divide uncontrollably.
And when it comes to the childhood cancers, what exactly are we talking about? What type?
Yeah, so this is called acute lymphocytic leukemia, and it's due to B cell, mainly B cell, and they just grow. And B cells is what makes the immunoglobulin, which is one of the strategies when we give vaccination. And so the B cell have to constantly change with the environment, with the organism that's come in. It has to keep changing, so you can tell that it has the increased risk of developing mutations in genes that will lose the control. But with that, our body has been really intelligent in trying to protect that. But in those who are susceptible, with the infection coming in, it gives them that risk of developing that mutation.
And how are doctors able to discover or determine the link?
Right. So that's the great thing about research, and I think that understanding more about immunology is going to help us to understand more than just cancer, but heart disease, diabetes, because the immune system interplay with multiple other stuff. So we know, and they knew this from a case study, that ever since they started this vaccine, they saw a 20% reduction in this common cancer, pediatric cancer. And so now they finally be able to look in the mouse and understand why that can happen.
What is the message before we let you go? 10
message is vaccine is important, not just for preventing cancer, but the most important, it prevents you from life-threatening infection. And this is just another bonus to why one should have vaccines.
Very important information. Doctor, thank you so much for coming in.